Hello, I'm Dr. Kieran Soda. In this video, I'll explain the further antenatal care you will have here in the UK. I've split this video into two sections. In section 1, I'll tell you about the care you will have up to 21 weeks of pregnancy, and the second section is about the care you'll get after this date. Let's get to it. After an initial appointment with your GP, you'll normally have an appointment with a midwife between 8 and 12 weeks. This is a detailed and thorough assessment, and you will have an opportunity to talk through any concerns or worries you may have. The midwife will also look to familiarise you with other aspects of your antenatal care. As your GP may have done, the midwife will screen for any other health conditions to check if you need any extra care. As you can see from this list, there are some medical problems that may mean you need additional care. The list is not exhaustive, so if you're not sure regarding other health issues, including if you've had any complications from previous pregnancies, please make sure to discuss these with your GP or midwife. They will also be interested to learn about any inherited or genetic disorders within your family that could affect your baby. Further support will be made available if your midwife feels you are vulnerable or at risk from any abuse or domestic violence, and this would be a good time to discuss any concerns you have. As well as discussing some of the information I've talked about in other videos, the midwife will talk in more detail about available screening tests, including blood tests to check for anemia, your blood group, and genetic disorders. You will also be made aware of the screening program available to test Down syndrome risk, and further tests if required. As previously mentioned, they'll provide information on pelvic floor exercises and other antenatal classes you may be able to attend. Soon after this appointment, usually around 12 weeks, you'll have your first ultrasound scan. This is a safe, painless scan that will check your baby's general development. It will also tell you how many babies you're having, so if you're having twins or triplets, this is when you'll find out. The scan will also provide an estimated due date. Between 18 and 21 weeks, all women are offered another ultrasound scan, which looks again at the baby's development. This time it's a more detailed check that will look at the baby's organs, including the brain, heart, lungs and kidneys, to screen for potential concerns or problems. After 21 weeks, you will have more regular appointments. If this is your first pregnancy and there are no major risks or complications, then these appointments will usually be every 2 or 3 weeks, shared between your midwife and GP. These appointments are a chance for you to raise any worries or concerns, measure your baby's growth, and also to check for any early warning signs of conditions that could lead to serious complications. You'll have your blood pressure and urine sample checked at every appointment. These checks are important as the presence of protein in your urine or rising blood pressure can be early warning signs of preeclampsia, a serious but rare complication of pregnancy that would need urgent treatment. Being pregnant also increases the risk of diabetes, which in pregnancy is called gestational diabetes. This can lead to persistently higher levels of sugar in the bloodstream, including for your baby. This increases the risk of complications for both of you, so your urine sample will be checked for glucose to monitor the situation. In the UK, there is a rising prevalence of gestational diabetes, and there are certain women who are more at risk, specifically women who are obese or have a family history of diabetes, and also women from certain ethnic backgrounds, in particular Afro-Caribbean and South Asian backgrounds. If your midwife or doctor feels you're at higher risk, then you will be offered further testing for gestational diabetes. Every woman in the UK will also be offered the whooping cough vaccine after 28 weeks, which protects your baby from this disease in the early stages of their life. You can have the flu vaccine on the NHS at any time during your pregnancy, and it's recommended you have this because flu can significantly increase the risk of complications for you and your baby. In later appointments, your doctor or midwife will check your baby's position and discuss how to prepare for labour. They'll also give you some information on caring for a newborn, breastfeeding, and looking after your own health. So that brings us to the end of this series. We've covered vitamins and supplements, diet, lifestyle, some of the financial help you might be entitled to, as well as further antenatal care. It has been quite information heavy, so do go back and watch again if you need to, or if you've missed anything. And if you have any questions, please be sure to speak to your GP or midwife. Thanks for watching, and remember to subscribe to the channel for further information and share with your friends and family.